Welcome back to What's Now. I recently spoke with the American Academy of Pediatric Dentistry, and they updated me on a lot of new information. For instance, when should you take your child to the dentist? Well, when they're actually still a baby. Here's more right now.
Did you know that leading health experts recommend children visit the dentist by age 1? Delaying children's oral care routines can cause tooth decay, possibly resulting in compromised health, development, and quality of life. Ahead of National Children's Dental Health Month, we are joined by Dr. Kevin Donnelly, President of the American Academy of Pediatric Dentistry, to reveal common cases of tooth decay, mouth monsters, and simple tips to avoid them. Thanks for talking with us, Dr. Donnelly.
My pleasure.
So, the age of 1, that surprises me. Why is that so critical?
Well, the American Academy of Pediatric Dentistry recommends that a dental home be established by age 1 because we know that the first tooth erupts right around 6 months of age, and at the first birthday, they don't have a cavity yet. However, we know on national data that 20% of kids aged 2 to 5 develop tooth decay. And so we want to get them right into the dentist and get them on a good prevention protocol so hopefully they can go disease-free. And as far as Utah, data shows that by 2nd grade, 20% of your kids already have untreated tooth decay. So this is a big issue, and we want to get kids in early to get them on good prevention.
Yeah, that is really young to already have tooth decay. So as a parent, how long and how often should you have your child brush their teeth? And when should you start flossing?
Well, you know, the American Academy of Pediatric Dentistry recommends that you brush for 2 minutes twice a day with a fluoridated toothpaste. But the important thing I think parents need to understand is they need to help their kids brush their teeth from infancy all the way through age 6, or when kids have the dexterity to be able to brush for themselves. And that could be usually age 6 or when they can tie their shoes.
Any advice on common little teeth woes and worries like thumb sucking or using a pacifier?
Well, as far as thumb sucking goes, it's really common. Most kids suck their thumb, and so I think parents get more worried about it than we do as pediatric dentists. We don't worry about it until, you know, the first permanent tooth is supposedly going to erupt around age 6. But kids start school by age 5 typically, and that 99% of kids stop the habit by then. However, if a parent is concerned or anything, they can sure hook up with their dental home and their pediatric dentist, and they can help eliminate the habit or even solve any problems that might have occurred from it.
You know, as a parent, sometimes you get a lot of information, especially about the health of your child, and sometimes it's differing advice. Can you clear any of those misconceptions up?
Well, I think the common factor was parents, when I was a little kid, were told to take their kids to the dentist either at age 3, and kids really were pretty cooperative and were mobile at age 3, or even age 5 because that's when they started school. But I think what we need to do is exactly what we're trying to stress here is get a kid in a dental home by age 1 so that they can be prepared to take care of their children. And as soon as that first tooth erupts, they can be able to brush their kids' teeth with the fluoridated toothpaste because parents just didn't know that.
Well, it's so good that we have new information. Thank you so much, Dr. Donnelly, for updating us and for encouraging us to take care of our teeth and our children's teeth.
Absolutely my pleasure. Thank you.
Thank you for watching this episode of What's Now. Tune in every day for more What's Nows where we stay up to date on all the trends. Also, check out parks3.tv for more exclusive programming information because if it's important to you, it's important to Parks 3 Television. We'll be back next time.